Hello. Look East can reveal tonight that thousands of NHS staff in this region are planning to refuse the jab for swine flu. The vaccine is due in hospitals this week and will be with GPs next week. Experts are worried if doctors and nurses refuse to be immunised, the rest of us could follow suit.
The overwhelming opposition of health workers to flu jabs is nothing new. Last winter, 4 out of 5 doctors and nurses refused to have the vaccine for winter flu. Many say they're sceptical about the benefits. But if predictions about swine flu come true and large numbers of people get ill, the health service could struggle to cope this winter, especially if many of their own staff go on sick leave. So far, 7 people from the eastern region have died after contracting swine flu and 5 others are critically ill in hospital. Our chief reporter Kim Riley looks now at the potential impact of swine flu on a health service reluctant to swallow its own medicine.
This is what all the fuss is about, the swine flu virus. It can be spread in millions of tiny droplets when someone coughs or sneezes. And here, some of those most at risk. Pregnant mothers at the Lazy Daisy Club in Ipswich, agonising over whether to have the jab.
At the moment, I'm still very unsure. I think perhaps if my midwife were to get the syringe out tomorrow at my antenatal visit and say, let's go for it, then I'd probably roll my sleeves up and say, go on then.
I'm quite nervous about getting the swine flu because I kind of feel that I probably won't be able to fight it off.
In two minds, really don't know. More information would be nice.
The number of new cases of swine flu in the region dropped from 30,000 a week at the end of July to well under 5,000, but it's now on an upward trend again. So far, an estimated 70,000 of us here in the east have had swine flu, for most a relatively mild illness. But 7 people have died, 20 are currently in hospital, and a second surge is expected to produce 500,000 new cases this winter. Swine flu vaccination campaigns have already begun in Australia. The first hospitals in our region get the vaccine on Wednesday, GPs and health centres a week later. Tim Morton, GP at Beccles in Suffolk, is having his seasonal flu jab. He'll be one of the first in the queue for the new swine flu vaccine.
If my patients see that I'm having it, I'm well and I feel it's very important, then hopefully by my example I can encourage my patients to follow suit.
But an internal NHS Essex document says we're facing a mini MMR crisis, people being influenced by negative media coverage, reinforced by staff scepticism, to believe it's safer to suffer the illness than take a chance with immunisation.
There was a particular problem with MMR where there was a scientific paper published which was then later rebutted. There is no particular problem with seasonal flu vaccine. We have it every year. The swine flu vaccine has been licensed and tested in exactly the same way, so it isn't really similar to MMR now.
The Royal College of Nursing is urging its 34,000 members in the region not to spurn the new vaccine.
Well, they could be putting themselves at risk as well as their patients, and we believe that it's common sense for nurses to think carefully about protecting themselves and those in their care.
Given the reluctance of health workers, do we want the vaccine?
I would have the vaccine.
Yeah, I would accept it because I'm pregnant, so I've got to accept it.
I think you should have more information about the vaccine and it should be explored more in the country, that everyone knows that there is opportunity to protect yourself against this.
No, I'm not intending to have any vaccinations in the near future.
Yes, I might well have it if it was offered to me.
I actually know family, friends that have had swine flu and everyone's just fine, so probably not.
Yeah, definitely, because at the end of the day, I don't want to get swine flu, really, yeah.
The jab makes you worse, I think.
Tonight, the NHS is warning of a severe strain on its services this winter. The fear is that hundreds of thousands of new cases of swine flu could leave our hospitals unable to cope. Kim Riley, BBC Look East.
So what's being done to make sure that doesn't happen? The number of intensive care beds in the region is being doubled, but will there be enough staff to run them? Nikki Jenkins has been to Northampton General to see what they're doing there.
You may feel that you're developing a bit of a cold over the next 24-48 hours, but it shouldn't be any more than that.
Claire didn't have a jab last year, but she wasn't alone. Fewer than 6% of nursing staff at Northampton General had the seasonal flu vaccine. So what about the swine flu vaccine?
Working in A&E, you're going to come into contact with that. We have done already, and it would be nice to know that we've got some kind of vaccine on board to help protect me against it, as well as help protect friends, family and other staff and patients.
With deliveries due on Wednesday, the problem is making sure Claire is not alone this year. Those with doubts were less willing to go on camera.
What are your concerns?
Side effects. And also, I think a lot of people take the flu jabs and they're actually worse off and probably get the flu. I mean, I think I'm of an age where I'm hoping quite resistant to the flu.
We're actually here, as I say, to answer any questions that you might have about the...
Convincing people to have the vaccination starts with convincing those who will have to give it. There was standing room only at this first briefing by the PCT today.
Right, so H1N1 is swine flu.
When we first started, it was a big job, but obviously as scientific evidence has emerged, it's we further allayed the anxiety, any residual anxiety, and what we're looking upon now is actually giving the staff the final information.
Instead of dropping clinics, teams will take the vaccine out to frontline staff in areas like A&E.
Swine flu is different from seasonal flu, and I think there is a reason for ensuring that people take this vaccine up, because we know it's going to put enormous pressure on our services in a way that seasonal flu has not done in the past.
Steps have been taken to dispel the myths, and managers say they'll be first in the queue to encourage take-up. Nikki Jenkins, BBC Look East in Northampton.
Well, let's talk to the person dealing with the pandemic in this region, Linda Sheridan. She's at the flu incident room near Cambridge. Will you have the jab?
I won't be eligible for the jab in the first round because I don't deal with patients, but clearly when I am eligible for it, of course I will.
What do you make of this if we see that doctors and nurses aren't prepared to or are sceptical about having the jab? How can you expect the general public to go along with it?
I think it's quite worrying if doctors and nurses are saying they won't have the jab, and I think it's probably not entirely true either. I think most doctors and nurses are highly motivated to protect their patients, and once they realise that it's very important that they protect themselves in order that they can then protect their patients and, in addition, their families, I think they will take the vaccine. I think there's a lot of misunderstanding out there. I think a lot of staff think... there was a lovely comment there from somebody who thought they were going to be immune anyway. They won't be immune. This is a very different virus from any we've had before. It's a new virus, and even if you're immune to any flu that was there in the past, you won't be immune to this one. Additionally, the fact that it's been mild for a lot of people doesn't mean it will be mild for you. And we also are very aware, as you've already quoted earlier in this piece, that people have been very ill with this and people have died of this particular flu. Well, it's vitally important that we do everything we can.
Sorry to interrupt you.
Yep.
You say that you're not sure that staff are sceptical about it. I'm quoting from something which came from a PCT in this region, which has been circulated to PCTs across the region, and it says, reinforced by staff scepticism.
Yes, there is some scepticism out there, there's no doubt about it. I think an awful lot of staff in the NHS, that they work incredibly long hours. I think they sometimes think they're invincible and that they won't catch this flu. And clearly we have a job to do to make sure that we communicate well with them, to advise them of the risks of getting the flu, to advise them that they will not be immune because of past exposure or past seasonal flu jabs, that they are at risk of flu. But even more important, that if they catch flu, they will infect their vulnerable patients, and their vulnerable patients may become extremely ill.
And of course,
some may even die.
We may have a case where you don't have enough staff to man the wards.
That is a possibility. Some of the modelling that's been done suggests that we could have quite a high rate of sickness absence if staff get flu, and that is a definite concern for all of us. So it is very important that staff take this vaccine. We've got information we've already had from Australia, and one of the things they've commented on is that the vaccination programme, which they began before us, did reduce the level of infection out there in the community and among staff. So it did help them, and they're very aware of just how effective it was. And I think that's a message that hasn't got out well.
Linda Sheridan, thank you very much for joining us tonight.